Well, Ken, I'm pleased to share we have Dr. Cherryl on with us today, providing valuable information on her experience and observations in fighting this COVID virus that's affected us all.
It's very nice to have her back again. I know we had her on a couple of months ago, but it's always good to have Dr. Cherryl back.
She's a wonderful, valuable resource of medical information and observation, and I think it's going to be a really interesting conversation with her about variants and how we can do our part in fighting this virus.
To have somebody here that's both medically and mentally giving solutions to how we can get out of this with more success than we have so far.
Absolutely.
Dr. Cherryl, thank you for joining us again. It's only been a couple of months, but it was very necessary to bring you back, especially what's going on in the world today. So how have you been since the last time that we talked to you in March?
Well, since March, I've been doing pretty good until the Delta variant reared its ugly head, which was around April and June. So the numbers are going back up again. But personally, I've been doing well, and thank God my family as well.
Okay.
What is some advice you can give regarding people who were vaccinated, but still are unsure of venturing out into activities again? Should we just feel free to do so if we remain masked? Are there still hesitations with precautions because of the uncertainty with the Delta and other variants?
Well, I would be vigilant because of Delta, but what the recommendations are, it depends on where you live and how prevalent the Delta variation is, i.e. how prevalent COVID infections are. People in high infection areas, whether indoors or outdoors, they're recommending masks. People in lower areas, if you're outdoors, they're not recommending masks. Indoors, it's still debatable. But what they are recommending in areas that have low rates of COVID, if you live with someone who is susceptible, that you do wear masks. The concern is that even if you're vaccinated, A, you can still get infected, but you're less likely to have a severe infection or become hospitalized. But B, you can be exposed, have infection, and then perhaps exposed to someone else who is immune compromised or can't get the vaccine. For example, children less than age 12.
Dr. Cherryl, how are we doing as a country with our vaccine rates? What is your opinion?
It depends on where you live. Like some states are doing very well with the rates of vaccine. I think Maine is an example. New York State is doing pretty well, whereas other states are not doing well with vaccines. Examples would be Florida and Texas. So it depends on where you live, the vaccine rate. And a lot of that has to do with perceptions about the vaccine.
Why do you think people are still hesitant about taking it when you said perceptions of the vaccine?
I think a lot has to do with where they get their news from. There's a lot of misinformation on the internet, for example, on Facebook. And this was news to me. I didn't know a lot of people, that's their primary source of learning is Facebook. I didn't know that until the pandemic hit and then learning how a lot of the misinformation is spread. So, but it's not monolithic why people aren't vaccinated. You have some people that have misinformation, and you also have some people who are against vaccines even before COVID. As I'm sure you guys know, people who didn't want their kids to get like measles, mumps, rubella vaccines, et cetera, because of their fears. Then you have people who don't have access to, who are not like affiliated with a primary care doctor or near a medical center. So they don't have access or they don't have the information about needing. And then you have some people who are afraid of needles and don't want vaccines for that. So I think approaching it has to be kept in mind that it's not monolithic why people are not getting vaccinated. We have to also remember the large group who can't get vaccinated, and those are less than 12, children less than 12. Because at this point, there isn't a vaccine approved for them. though they're ongoing studies. I think I read Pfizer is expecting within the next few weeks to be able to present data
Okay.
to the FDA toward getting something approved for children less than 12.
I had a question about basically the spread of the Delta variant, as far as the rapid rate of spread that actually occurred. As I've been looking through the information that I can get and knowing where its origins were and how quickly it spread across the world, do you have any information about just basically dealing with the rapidness that the Delta variant was actually able to spread versus the other variants?
Well, that the point with the variants is that they're mutations, and the virus basically mutates for its survival. What we're seeing with the Delta variant is that it's more easily transmissible. People get higher viral loads and they get sicker. Now, what is the mutation with that variant that makes it more highly transmissible? That I don't know.
Okay.
There is another variant that is a variant of interest, and that's the Mu variant. Also, that was in the news recently. That's being monitored. I understand it is in the States now. That was seen primarily in Chile, Peru, and Colombia, but now that's in the States. But they, at this point, don't know whether or not that's going to be more highly transmissible or more virulent than the existing variants, but it's being watched. The Delta variant is responsible for 99% of infections currently in the United States.
Could you explain the purpose of the booster and if people who are vaccinated should get the booster?
Okay, well, let's break it down to different concepts. One is a third dose and then the other is a booster. Third dose are for people who are immune compromised, where the first two vaccine doses may not have gotten the immune protection that is required. And those are people who are actively getting chemotherapy, people with stem cell or solid organ transplants, people who have HIV that's untreated or severely advanced. Also, people who are on medications that cause immunosuppression. For those people, they're recommending a third dose. As far as boosters, a lot of it is the same population. Boosters are otherwise people that don't fit those categories, but people that may have chronic disease or older population that they're recommending a booster dose. These people were able to mount an adequate immune response, but the theory is that over time that immune response may decrease, and that therefore a third dose is recommended. The booster is recommended. At this point, it's the immune compromised that the FDA have approved. They have not approved seniors yet that are healthy seniors yet, but I suspect that that is coming. Because what has been seen is people, particularly over age 65 and over age 70, that over time the immune response has decreased.
I had a quick question about the rarity of the breakthrough cases. A lot of attention's been paid towards the breakthrough cases, especially the ones that end up in fatalities, but still dealing with the difficulty or the low percentage rate of how many breakthrough cases that actually happen. I think a lot of the news media is focusing in on the breakthrough cases, but not really focused on the rarity of when they occur. So if you could speak a little bit about these breakthrough cases and how the breakthrough cases are actually happening or how they're reported. Because I think what's happening is that a lot of people are getting misinformation about the breakthrough cases, which make them going like, well, if I can get vaccinated, I can still get it. Why get vaccinated? If that makes sense.
And that's true. And that is part of the misinformation. I'll start with most vaccines. What they confer is protection against severity and potentially death. But I'm giving an example of the flu vaccine, a pneumococcal vaccine. Having been vaccinated against those things, or the shingles vaccine, does not mean you can't get pneumonia, you can't get flu, you can't get shingles. What the vaccines confer is that you're less likely to have severe cases, you're less likely to die. Coronavirus vaccine is exactly the same. It does not mean you can't get coronavirus, but you're less likely to end up hospitalized and you're less likely to die. There's only one vaccine that if you get that, you're not likely to get infected at all. And it's only one, and that's Gardasil. So put it in perspective that there you have one vaccine that can confer protection against getting, but all the others doesn't mean you can't get it. You're just less likely to get severe disease and you're less likely to die. As far as the people being hospitalized current, or as you call the breakthrough infection, these are people who are fully vaccinated. It's less than 1% of those are hospitalized. Currently, 90% of the people who are hospitalized are unvaccinated. 90% of the people who are currently hospitalized for severe COVID infection are the unvaccinated, not the vaccinated. And even those who are fully vaccinated, those who become severely ill tend to have underlying other medical conditions that would make them more susceptible.
Mm,
Well, thank you for that.
yeah,
Thank you.
yeah.
Yeah, so I've come across that too. Well, I'll get a vaccine and I'm going to get it anyway. So it just makes sure that that distinction is understood, that you're less likely to get severe disease, you're less likely to be hospitalized, you're less likely to die from it.
Doctor, could you speak about the role of the antibodies? Because I have heard from several people who are hesitant about getting a vaccine because they've had COVID and they have antibodies. So could you speak to the
What's
potency of
not
the
sure,
antibodies?
and that comes up too. All the questions you're asking are great questions because these are the things that come up. What happens with people who get the antibodies from the coronavirus or having had the coronavirus vaccine? What we don't know is how long those antibodies will last. And also having had the coronavirus infection does not mean that you cannot get reinfected. So you can get reinfected if you've had it once. And also if you have the antibodies from the infection, we don't know how long those antibodies would provide protection. So the vaccine is still recommended.
Okay. Thank you, doctor.
And now with schools opening up, I know California, the schools have been open for a while and they've been getting cases like left and right. I know they're probably going to stay open until they're basically forced to shut down. In your medical opinion, how do you visualize what the future might be, especially as we're moving towards these fall months and the spread of the virus?
I think what's key in the school setting is to vaccinate as many, again, children under 12 cannot currently get vaccinated. So to encourage as many adults as possible to get vaccinated. I think, again, in the school setting, social distancing still has to be maintained, masking, hand washing, et cetera. Those mitigation strategies have to be enforced. But if vaccines are given to adults who are around the children, or I think that can decrease the infection rate. And also as far as children, most of them, if they get infected, it's milder cases than adults. However, children can still spread it to adults as well, adults spreading it to children. So again, you wanted to mitigate where you can, which includes some masking, et cetera, but also very important that adults be vaccinated.
I have a question that deals with the politics of policy and medicine. I'm curious if the medical profession feels that their skills and knowledge have been taken into consideration in driving policy, because I don't think they have been, because I see such a difference among states and among areas. How some places have this policy about a vaccine passport, and some states don't. And I'm just wondering, is the medical profession being asked about their experience, their knowledge of this virus in helping form policy?
I think most of the policies are coming from the federal government by way of the CDC. So we'll start with those policies, and that is manned by a lot of healthcare professionals. On a local level, I think, again, it depends on where you are. I think, well, actually, a friend of mine just sent me something, American Board of Internal Medicine, and I think American Board of Pediatrics has just put out a statement to doctors to disincentivize disinformation being given to patients. Because I think if you look at the science, again, it's not regional, it's not political. You just look at the science. However, how it's being communicated is political in some places, and also is not really following the science. Again, it depends on where you are, what's being communicated to patients. And also depending on the individual, because you have some places in states that are low vaccinated, the doctors really are trying to encourage their patients to get vaccinated, or the population in general to get vaccinated.
I'm just thinking of the differences with New York and New Jersey with entrance to public places with vaccine passports or proof of vaccination in one state, whereas another state close by doesn't have that. It's just not very cohesive.
Well, remember initially when this happened, the states were coordinating, New York, New Jersey, and Connecticut, and Pennsylvania. I think that has waned. But
Yes.
what I've also seen, though, is that once, I'm going to speak strictly about the Northeast,
Yes.
that I have found that one state might be the leader, but the others, they generally do eventually follow the science. I found in this area, New York tends to lead the way, but New Jersey policies, they come up to it.
Do you feel that maybe the lack of science education has led to where we are now, as far as the thought processes of people when it comes to things like viruses and understanding what's going on?
I think that certainly plays a role, but I also think, honestly, politics plays a greater role. What I'm finding is that people gravitate toward resources that support their beliefs.
Mm-hmm.
They're not necessarily looking for facts. They want things that support their beliefs. And then that, I think a lot of it is political. Some just plain, run-of-the-mill ignorance, but it's not ignorance that people are seeking to get rid of. I do think a lack of a scientific background and scientific knowledge can play a role, definitely.
Are you surprised, disappointed, not surprised that we're still having this conversation?
Oh, absolutely disappointed. I was looking for this talk, I was looking at numbers of coronavirus cases. And in June, so I had actually jotted down, in June of 2021, number of cases per day was down to 12,000. And then you jump forward to September, now we're back to 105,000 per day. And a peak in 2020 was 197. So we had that tremendous dip, and now we're back up again. So tremendously disappointed that we have the tools, and we're fortunate in this country because some other countries, they don't have access to the vaccine like we have here, but we do. We have access to masks, and yet individuals in this country are choosing not to use them. And not only are they choosing not to use them, but they deride people that choose to use them. So yeah, to answer your question, tremendously disappointed and tremendously sad.
As a member of the medical community, is your community exhausted? Are
frustrated?
You frustrated?
Very frustrated, because I, like a lot of people in this country, have lost colleagues. Also have colleagues that have long-term COVID side effects. So we've seen it not only in patients and family, but colleagues that have worked tirelessly towards saving people, and yet they're still coming. And it's not, at this point, it's something that doesn't necessarily need to be.
From my friendship with you, Dr. Cherryl, and my relationship with other people in the medical profession, I've heard the word calling. That is a very unique, special calling where it's a selfless profession, and it's very unique. And I'm wondering, do you see people leaving the profession? Do you see people maybe saying, I don't know if I can be a part of the profession anymore, because they're so burnt out and frustrated?
I think some of the older people possibly leaving. Thus far, I think, particularly at the peak of this, you actually had more younger people interested because they wanted to make a difference. But I think as this drags on, and as people still don't take the steps that could really turn this thing around, that you may have people deciding, why should I risk myself? Why should I risk my family? So I would not be surprised. Just to give you some statistics, if you're unvaccinated, you're 4.5 times more likely to get infected 10 times more likely to be hospitalized, and 11 times more likely to die. Those are the current statistics for unvaccinated individuals.
You had mentioned long-term COVID consequences. Are you? I hear this from friends, who say, "I don't feel the same. I
No,
just don't feel
absolutely.
the same anymore."
Absolutely. And then I would caution people to keep that in mind who think they'll get COVID, they're young, they'll beat it. There are long-term consequences. You may not die from it, you may not be hospitalized, but you may suffer long-term consequences from the infection, which can include shortness of breath, decreased exercise tolerance, chronic headaches, chronic fatigue, also mental cloudiness, depression. The list goes on. So people who are young should take heed also that there could be potential long-term consequences to them not seeking a vaccine.
And there's not enough research to support the turnaround of these consequences, if they can be reverted. We don't know if it.
We don't know.
We don't
It's
know. We don't
ongoing.
have it.
It's
No.
ongoing study. Absolutely. It's ongoing with a lot of them. And I know some of the hospitals near me actually have clinic settings now for COVID long haulers.
Mhm.
And that's the term that's used, so that they can be evaluated on an ongoing basis.
I so applaud you, Dr. Cherryl, for what you do every day. And I hear interviews with doctors and nurses in the South, and they are just, and in the West are just so exhausted and frustrated. And I feel for them. I feel for the community.
Yeah, I do too. I do too, absolutely. And it saddens me to see that. And it saddens me also that so many people believe so many misconceptions about not only the virus, but healthcare. I had the opportunity to talk to people who think that the statistics reported regarding COVID deaths are not correct, that it's, that they're falsely inflated. I've had patients, and I'm sure you guys have seen this too in the news, who feel that the vaccine will insert a tracking device. Where that came from, it boggles my mind, but people believe that. Also, that it alters their DNA. And back to your point, Ken, if you know where the vaccine works, it's in the nucleus of the cell, it's in the cytoplasm of a cell.
Right.
DNA is the nucleus. The vaccine does not even reach where it would have to reach if we're going to alter the DNA. So that's a fallacy. Some people believe that it impairs fertility. There's no proof that it does. I even saw something that they think that the vaccine confers some type of metal contamination, and it doesn't. So I think as much as we all can learn to maybe have a conversation to dispel some of the myths that are out there about what the vaccine does and what it doesn't do.
Because some of the myths that you mentioned just now are supported by MDs as well, I've seen.
Yeah, and that's why I should have printed the document that I just read this morning that a friend sent me. That's why I'm glad some of the medical boards are now taking a stand. As a matter of fact, they're thinking about penalizing doctors that purposely perpetuate misinformation to their patients. This was a statement that I just read it this morning. So I'm glad to see some of the medical boards are starting to put their foot down and say, no, it's not okay for you to do that to your patients, because it's really potentially doing their patients harm.
It's interesting because, the politicizing this vaccine, when, if you're traveling to certain places and there's the yellow fever vaccine, there's no question.
Yeah.
Oh, sure. I want to take my trip. Go right ahead.
Yeah. The whole thing, it's not logical. For instance, nobody likes taking off your sneakers at the airport, but we did it, right? But now you're yelling about wearing a mask. It's not logical. A lot of it just boggles your mind because and then even with the tracking, people think they're afraid of the vaccine inserting a tracking device. And then my question to those people is, do you have a cell phone? If you have a cell phone and you're wearing, you know what I mean? It's just silly. I shouldn't say that, but it's not logical.
I know in June, because I know Yasmin and I, we were getting ready to, when we were working on talking to you the first time, we had done all this research on the Spanish flu.
Mhm.
And as we reached June, I thought we would not be repeating the same lessons that happened over 100 years ago. But right now, it feels like we are going to be doing the exact same thing that happened 100 years ago, and it might be worse. Do
And
you feel
it's not necessary.
it's not necessary because we have documents and research that say this is how we survived it 100 years ago. But looking at everything that's happened so far, it's almost like a mirror of what happened back then. Do you feel that there's a point in time in which the people that are doing their best to help will get exhausted to the point where they give up? Because
I hope not.
because that's the one thing that I'm starting to feel towards, especially friends of mine that have just gotten to the nursing industry or into the medical field. They just graduated like a year ago, or even in the middle of this, are already starting to feel the sense of fatigue. And it's not about fatigue for the caseload, it's the fatigue of dealing with the individuals that won't accept what the medical facts are in front of them.
Yeah, and you're human beings. Medical professionals are human beings, and we have limits and we have fatigue. Because again, our lives are at stake. Our families can be exposed. In addition to how complicated and ill the patients are. And the fact that we have something now that could prevent you from being this ill. It's not like 2020 where we didn't have mass amounts of mass amounts of potential to vaccinate people.
Yeah.
But we do have the capacity to vaccinate people. It's just people are choosing not to. And then they're getting sick, and then they're in the healthcare system, and a healthcare system that is overwhelmed and frankly tired.
And it's very sad when you hear these stories of people on their deathbeds who want to take the vaccine, but it's too late.
Or I've also heard of people on their deathbed from COVID who still refuse to believe that they have COVID. Like, what do you do with that?
And still at the same time, like people that are in car accidents, that have heart attacks, or having other things that can't go to the hospitals because there are no rooms for them.
How about that? Yeah, I saw something on the news, I think it was a week or so ago, about a person who needed surgery, and he could not find a hospital that could accept him. And he ended up dying from a treatable condition, but there were no beds for him.
There's a hospital in, I think, New York State that cannot take deliveries anymore. They don't have the staff.
Yeah.
This whole trickle down effect from COVID, people have to understand how it's going to affect everything.
Yeah. So I think too, and I was thinking about this talk, like how can we continue to make inroads in people who don't want to be vaccinated? And I think, again, step one is to recognize that it's not monolithic. So that each of the different areas, I think people who are anti-vaxxers, I'm not sure if you'll ever be able to reach them, but some of the others, people who don't have access, people who have misconceptions, those people could potentially be reached. But I think that has to be done on a grassroots level. I don't think, well, obviously the president making statements hasn't really made an inroad, but I think that if there could be grassroots initiative toward reaching those people, you might be able to make some of them change their minds. Like I've had, again, on a grassroots level, some discussions with patients, and I've been able to persuade them by addressing what their barriers are, but it's a one-on-one and they're talking to someone that they trust. So I'm hopeful that across the country that there can be analysis about why, and I'm sure it probably already exists, why these people aren't getting vaccinated, and that can be specifically addressed by local people that they trust.
I understand the science, but I also feel conflicted when I hear of employers letting go their employees who are not vaccinated. I feel I was speaking to a friend who lives in Brooklyn, and she was passing by a restaurant she frequents, and there was a lot of commotion because the owner let go of pretty much the whole kitchen staff who wouldn't get vaccinated.
Mhm.
And this kitchen staff had sustained the restaurant throughout the whole pandemic with takeout, and they went to work every day and they did what was asked of them. So I understand the science, but I don't know if, is that the solution to
I
release
think
people from
if
their jobs? I
if
don't
they don't get vaccinated, I think the fallback would be to make them have weekly
know.
tests, which a lot of states are, what a lot of places are currently doing. I think, oh, I think it was is it the NFL?
Yes, I was just going to
Yeah.
That
ask
they're
about the
doing
NFL
daily tests,
model.
I think,
Yeah,
for unvaccinated. I think
yes.
they're requiring daily tests. I know in New York, some of the places they're requiring weekly tests for people who refuse. And I think that's what President Biden actually stated for employers who have over 100 employees, that they mandate that they be vaccinated or have weekly tests.
Can you explain something to me, Dr. Cheryl? I don't understand. So there's a very large university in New York that is requiring vaccination of their student population, faculty, staff, but they're also going to do random testing of students. So even if you are vaccinated, you may be selected for a random testing. What's the purpose of that if the whole community is vaccinated?
I would think two reasons for doing that. One is, again, because you're vaccinated does not mean that you can't contract the virus or spread the virus.
Okay.
But the other reason I would think for doing that is to try to err against those who may present false information about vaccination.
Is that happening? Do you hear of people presenting false vaccine cards and?
Oh
Yeah.
yeah, definitely. Definitely. There was a lady arrested recently for selling them. So yeah, that's what I would tend to think the reasoning behind that. Have you seen that in California too, Ken? In
I
New
haven't seen
York,
it in
I've heard of
California,
it.
but I saw the news report about the woman that got arrested because she was trying to sell the fake vaccine cards, but she misspelled Moderna. And that,
I didn't hear
that
this yet, misspelled Moderna.
yeah, it's kind of like, gives you a perfect example of why that person got arrested. But the idea that people would go to that point to fake the vaccine cards,
Mhm.
I think the idea of not understanding the seriousness of what's actually going on.
Absolutely. That's what I'm thinking too. They don't really understand the seriousness.
And the other thing that popped into my head was about just mental health of medical professionals. Knowing that the amount of stresses that are happening right now, do you feel that the medical board is at some point in time going to kind of suggest dealing with psychological type of help for their current medical staff as they're going through this? Is just more of like a suggestion, not like a mandate, but
Yeah, I don't know that they're doing that on a national level, but I know on a local level, hospitals have programs or have access for employees that need it, because a lot of the medical personnel are suffering from post-traumatic stress.
Mm.
And that's being recognized locally, and then there are resources available. But it is, I see a lot of people with stress that are hospital-based. The sad part is these people need time off,
Yeah.
but then they need time off in an area that is strained.
Mhm.
But if they don't get the time off, they're not really able to function. So it's a circular situation.
Were they going to shorten medical school to 3 years to get doctors out quicker?
Oh, I didn't hear that, but I know, like, at one point, people who were like in their fourth year, they were graduating them earlier so that they could. But I don't know that that's something that's going to be ongoing.
Yeah, I know at the height of the pandemic, I know NYU
Yeah.
medical students were able to jump to.
Exactly.
Yeah.
Yeah.
Do you feel, doctor, and I mean, maybe you personally or your friends, do we feel more comfortable going out to public places, large venues like restaurants, or now theaters are reopening, and even with the variants, though if we're vaccinated, should we just feel comfortable to go out and
Well, I would say again, just because this is the caveat, that they're still recommending for large indoor venues that you do wear a mask. New York, it was not touted as one of the high prevalent areas right now, but I would still, if I'm going to be in a closed environment, wear a mask. I'm speaking for myself personally. That's what I intend to do, and do as many outdoor activities as I can. Because I'm still a little nervous.
I've gone to the movies twice.
Hmm.
Once was a private.
Did you wear a mask?
I did. Once was a private screening, so we were all socially distant.
Mm-hmm.
And the second one was just a regular screening, but there was barely anybody in the movie theater.
Okay.
But it's still the idea of like going to get popcorn, going to drink, and, but basically the woman that I take care of, we were like together. And then my best friend, we were like, there were 2 seats between everybody that was there.
Mm-hmm.
So, but it's still at points in times where I just like, you can go into the grocery store, going to buy, electrical equipment, everything. It's sometimes you just get that feeling like, yeah, I'm going to go.
Yeah. I mean, I still wear masks when I go to the supermarket, and where I live, most of the people have masks on too. Very few don't. So we're all still pretty masked up here.
I know there was a week in which I was going to the grocery store, where they're like, if you're fully vaccinated, masks are optional. It's like, woo. And then I walked in one time and I just saw this guy and I said, I'm putting it back on.
Yeah.
I have it in my pocket. I'm just going to put it back on. Just mainly because it shouldn't be such an issue, but it is. I'm not trying to understand the psychological aspects behind the lack of or the violent reactions that the people are having to wearing a mask. But all I can do is be vigilant for myself. When I stopped thinking about how to get people to convince to either get vaccinated or wearing masks, realizing the exhaustion it got just to me trying to spend time explaining this to an individual. And then I realized that the only thing that I can do is basically protect myself. That's the best thing that I can do.
Yeah.
Where I teach, I taught summer school for the first time, I think, in ever. And I just started the academic year. I am very impressed with the students. During the 6-week summer program, there were days it was quite warm. They were very vigilant about keeping their masks on the whole time. And now, since we've started the academic year, all day, very good about it, knowing exactly how to wear it, what to cover. I'm very impressed with this generation.
Yeah, and I'm happy to hear that also. Makes me wonder though, when we were talking about the mask, because to me, it's one thing if you decide not to get vaccinated, I mean, having that discussion, but to have such a violent reaction to wearing a mask, really makes me wonder, what does that mask represent to you? Because it's clearly not just an issue about wearing a mask.
No.
And again, do you have the energy to even engage in that discussion? And would it be a fruitful discussion? That's the next question for yourself. But clearly it's not a mask. It's not, the mask is not the issue. There's something deeper there.
UNESCO was posting pictures of children in different countries going back to school. And you can see in some countries, they make do with what they have. They don't have the access that we have to masks. And they do it. And they, with limitations, they do what they have, what they can with what they have. And here we are.
Yeah, and it goes back to what we were saying before. Yet these same people will take off their sneakers at the airport. These same people will get rid of their water bottle at the screening station at the airport. Yet you won't. It's not logical. So again, I say that mask represents something else.
Oh, Dr. Cherryl, I hope we don't have to have this conversation 6 months from now. I don't know.
Because what concerns me also is we're about to go into indoor season, flu season. So I'm still going to be perpetually optimistic that more people will get vaccinated, whether because they see the light or because their job requires it. ideally, you want people to do it because they see that it's something that's useful. But if not, then do it because you need to keep your job. And I know that goes back to what you were saying, Yasmin, but it's a bigger picture to me.
Yeah, of course. Of
Yeah.
course. I understand that too. Absolutely.
Yeah.
I have a question about flu season. Last year, the numbers for the flu were lower, and some people said it was due to mask wearing.
Yeah, I believe it
Okay.
was.
All right.
Yeah, so that's another reason to wear a mask because there was less cold and flu last year.
Right. Would you still recommend the flu vaccine, even
Oh,
if they're masked?
absolutely.
Oh, okay.
Oh, no, absolutely.
Oh,
Yeah.
really? Okay. My
Particularly
doctor
for high
asked me to
risk.
take it, and I said, I don't know yet. I don't know. Let me think about it.
No, it's particularly if you're high risk. If you're
Okay.
young and healthy, again, you can decide whether you want it, whether you normally get. I mean, you're exposed to a lot of people in
Yeah.
school, so you may.
I probably will.
But otherwise, if you don't have high risk and you're not, you're less than age 65, then you can decide whether you want it. In general, I take it as a healthcare
Yeah, of
professional,
course.
again, because I'm exposed to a lot of people.
Mhm.
But I offer it to everyone and the
Yeah.
high risk people typically, but even some young, healthy people, they want it. So
Here we go again with the topic of the, high risk or low risk with COVID. It didn't matter.
yeah,
It was it's a very unforgiving virus.
exactly. And you never know who's going to get well, people with certain medical conditions are more likely, but even people without those medical conditions,
Right.
you don't know who's going to be who with COVID.
Dr.
Yeah.
Cherryl, what's the timeline for the flu vaccine now until when?
Well, usually you want to get it September, October. You can get it until the end of the year, like if you miss that, but ideally between September and October is when you want to get it.
And you shouldn't get it the same time you get a third shot of vaccine.
Oh, no, you can. You can get them the same day. You can. You can. Yes, you can.
Wow.
No, you can get them the same day. Oh, speaking of which, I just wanted to share with you guys something that I just read yesterday, which to me is good news.
Oh, good.
Yeah, have you guys heard of the monoclonal antibodies?
Yes.
Okay, so the recommendations for the monoclonal antibodies before was if you had to get it within 3 days of a positive COVID test. And what it does is it potentially decreases severity of the illness and hospitalization and death. And these were people who were not vaccinated. What's new is now they have a post-exposure indication for the monoclonal antibodies, meaning that if a person has not been vaccinated and they've been exposed, they are eligible for the monoclonal antibodies, which can, again, prevent severity of illness, hospitalization, and potentially death from the virus. So there's hope for people who are not vaccinated or exposed, that they should inquire about the monoclonal antibody.
Thank you.
And that's new.
Oh, good. Okay.
And the way the monoclonal antibodies work is you've seen the pictures of the coronavirus with the ball with the spikes. The monoclonal antibodies bind to the spikes, so it decreases the virus's ability to infect cells.
Oh.
So that's important for non-vaccinated people or people who've been vaccinated, but again, are immune compromised and haven't gotten a third dose, to know that they are eligible or may be eligible for the monoclonal antibodies. And so they should just really, as soon as possible, discuss that with their doctor.
Oh, thank you, Dr. Cherryl. Thank you so much for that.
Yeah, I just read that actually yesterday. It's new, hot off the presses.
Are you slightly optimistic, Dr. Cherryl, or?
Yeah, I am, but that's my nature.
Yeah, I know.
Yeah, so I'm, express, yeah, definitely. I'm hoping that enough people get vaccinated, and that we can turn this around and that there aren't any new variants to worry about. Thus far, the vaccines that we have are effective against Delta, and I'm hoping, again, that they remain effective. Or if there is a mutation, because we have now the messenger RNA technology, that they'll be able to adapt the vaccine that could handle a variant that may not be as susceptible. So I'm still going to be optimistic.
Well, if you are, then I will be.
Absolutely.
And as I was reading, it seems like the Mu variant seems like from what they've looked at so far is not going to be as easily spread as the Delta. So I'm
There's
hoping
no evidence that it
there's no
is.
evidence that it
Right.
is, but right now it's leaning towards where, I mean, hopefully I'm keeping my fingers crossed.
Yeah,
I'm keeping my fingers crossed because knowing
Yeah.
that you're there,
absolutely. Keep your fingers, your toes,
everything.
everything. Yeah, because we also have to hope that more people get vaccinated. And again, that another new variant that won't be susceptible to the vaccine does not develop.
Yeah.
But again, I'm going back to but even if it does, we now have technology in terms of developing vaccines that might be able to handle that as well. Optimism.
Yes. Optimism.
Yes,
That's a nice way to end. Optimism.
definitely, because what we need most right now.
Yeah.
Yeah. And even though we're all tired and we're frustrated, but just to do our part, that if there is somebody that's vaccine hesitant, to maybe engage them, to see if maybe you can impart some knowledge that they don't have, or to steer them in a direction if they have misinformation that they've accepted as truth. So I think the government does their part, healthcare systems, but we as individuals also can try to do our part also, because we're all at risk if enough people remain unvaccinated. So it matters to us collectively that more people get vaccinated and we can decrease the transmission of the virus.
Thank you, Dr. Cherryl, not only for being with us today, but also for what you do every day.
Thank you.
You are a hero, and I am grateful for people like you. I think we all are. Until next time.
Oh, we do this.
Yeah,
Wow.
let's do
All
it
right.
again.
Okay, cool.